The Role of the Disclosure Coach by Dr. Joe Shapiro, in collaboration with the Institute for Professionalism and Ethical Practice.
I would argue that because this is such a hard thing to do, that is, have a disclosure conversation, it's so the right thing to do, and it's so hard because it's at a time of maximum both patient, family, and clinician vulnerability, and that there's a gap between what patients want from our disclosure and what we've been able to give them for all the reasons that we talked about, that this disclosure conversation, the ability to do this requires skills and sometimes advice in the moment, and that we need to support each other in doing so. So just like any other times when we're struggling clinically to give the right care, I would say this is a time to think about getting colleagues to help us give the right care to the patient. And by care, I mean showing up in a way with them in conversation that's transparent and compassionate. So to that end, at our institution, we have a disclosure coaching program. And it's built on the premise that we need to help each other and that we should teach disclosure and apology, which this program is working to do. That said, because we are unlikely to have a lot of experience, each of us individually, in having these difficult conversations with patients, that in the moment, we're probably going to need help in doing so. And the reason we're unlikely to have experience is, fortunately, we aren't going to be making that many errors over the course of our individual careers. So the disclosure coaching program is built on the premise that we need to be there for each other and that most of us are going to need help in the moment and not necessarily able to hold on to the teachings about how we should do this theoretically, maybe several years before we actually have to go and disclose an error. The other principle, of course, is that disclosure is a process, not an event, so we're going to be there for each other during the whole process. Some principles that we teach in the disclosure prep conversation is that it should be an opt-out process. That is, if you decide that you don't think a disclosure should happen, we're going to be asking you to get a second opinion. And the disclosure prep, the conversation about whether disclosure should happen, and if so, how, that involves another person, and that would be a disclosure coach. So I do a lot of the disclosure coaching at Brigham and Women's Hospital, and a lot of it is meeting with the group, deciding how should disclosure proceed. There are instances, not many, but there are where actually the decision to disclose or not is not obvious and needs to be discussed. A really important principle is to identify your emotions and check them at the door. It's because you don't want a negative emotion to be leading your conversation with the patient. I work with a patient advocate named Meg Gaines at University of Wisconsin, and she's reminded me that the emotion of empathy is not something we should leave at the door, that we always do want to bring that in. It's very important to pay attention to the medical and social needs of the patient, some of which you may anticipate and explain, but some of which you won't know until you ask what their needs are as you have the conversation. It's also important to stick to the facts of what happened without speculating about things you don't understand at this moment. It's absolutely fine to say, I'm not sure about that, we're going to look into this and we'll find out more, and I'll come back to you when I have more information. With regard to apology, I think the problem with the English language is the word sorry can both mean simple empathy, it can also mean an apology. And the one word can mean two different things depending on the context. Our teaching is, it's totally contextual, it's a perfectly great word to use, just to simply say it in which way you mean it. If it's empathic, it's, I'm so sorry this happened. If it's an apology, it's, I'm so sorry we made this error, or I'm so sorry I made a mistake. It's important, again, to say we don't know yet, that it's a process, that we'll be meeting with you again. We'd be happy to answer questions, if that's true. And then that we're going to look at this and figure out how we can learn from it, though, of course, it won't help that individual patient or family, but we do hope to improve our care so that other patients will not have the same thing happen to them. It's most important to leave space and time for the patient or family's questions, concerns, and expressing their own emotions.
Reflective exercise. Please post your responses on the comments board for this video so that others may learn from them.